Welcome back, everybody. 11:37 is your time on this Tuesday. As you know, May is Asian American, Native Hawaiian, Pacific Islander Heritage Month. Say that 10 times really fast. And KVUE News Midday continues to highlight people and groups in this community that made an impact in Austin. So we'd like to welcome Haley Easley. She's the Executive Director of the Austin Asian Community Health Initiative. Thank you so much for joining us, Haley.
Thanks so much for having me.
Absolutely. So what does your group do to enhance public health and well-being for Asians here in our community?
So we employ community health workers who are bilingual from the communities they serve to act as the bridge between the existing resources in Austin, which we have plenty, and the communities that are in need.
Yeah, and so as the Asian American, Asian population continues to grow here in Central Texas, when did advocates realize there was a gap in healthcare services for this group?
So in 2013, we partnered with Austin Public Health, who is an amazing partner for us, by the way. They did a qualitative study. They did multiple focus groups in different languages with different language groups, and found that there was a huge issue with healthcare access. So the nonprofit was actually originally meant for developing the AARC, the Center for Asian American Communities. But once we realized how great the need was, they decided to move over to this new model where we have, that we're using now.
Yeah, so how many people have y'all served so far?
We serve about 400 people and their families per year. Primarily, our current populations focus are Vietnamese, Korean, and Burmese. Burmese communities include a lot of different ethnic groups. Karen, Karenni, Chin, Chintivim, lots more. And about half of our population includes seniors over 65. So that's kind of what our demographics look like every year.
And why are these groups underserved? What's considered underserved?
Underserved meaning they're facing barriers to access. So about 98% of our clients have low incomes. Most of our clients have major barriers to transportation. And then the biggest barrier would be language access. So most of our services only have partial or even just very limited language access towards using their services. So even like buses or being able to schedule an appointment, paying your bills, all of that is inaccessible because of the language barrier.
Yeah, I think a lot of people don't realize there are hundreds of different ethnic groups, which means hundreds of different languages, right?
That's right, yeah.
And so if people want to help or they need to just access your services, what can they do?
So we have, what's really great about ACHI is that we're very aware of our language needs. So we have multiple phone numbers for different languages, and we also have language line. What they do is they call us, or a social worker or someone will refer them to us. They do a quick intake, and then our navigators will help them with whatever health access needs or even basic care needs. So like food, housing, bills, and they will help them navigate them through that process.
No, that's great. Can you say your website real quick?
We are AACHI.org.
There you go. Haley Easley, thank you so much. She's the Executive Director of this group. We appreciate what you're doing. We appreciate you coming here.
Thanks so much for having me again.
Absolutely. We'll be right back.